Philly, Canada, Massachusetts, Nashville. Awesome. You guys are from all over the place. Florida. Oh, love that sunshine state. Hopefully you're getting some nice weather right now. All right. There's still some people coming in. Um, very cool. All right. So some of you guys probably are coming to from the 21 day challenge. This webinar was open whether you came to the 21 day challenge or not. So if you are coming from the challenge, same thing, just like type a yes in that chat box for me. I'd love to know how many of you guys are coming off of that versus found it another way. I got one. Okay. Because that'll kind of help me guide what we talk about a little bit too. Challenge. Okay. Let's see. Awesome. And feel free to, if you guys want, you can, show your cameras. I love to know who I'm talking to. You don't have to, but feel free if you want to. The 21 day challenge. Okay, awesome. Yeah. All right. So it looks like a fair number of you guys. As I figured, this was kind of like the end point of the 21 day challenge, but I did open it up to anybody who might want to come into it because I think either way, it's going to be really helpful for you guys. Even if you're not coming off the challenge, I think you're still going to learn a lot from this. So we are, of course, today talking about breaking free from hip pain. So this includes impingement, labral tears, if you're struggling with dysplasia, hypermobility, all these types of things. If you've had surgery, you're thinking about having surgery, we're going to kind of talk about what is the next step in all of this. Um, so, like I kind of was saying, you are, I want you to know that you are in the right place. If you are somebody who has any of those things that we've talked about, or a lot of people find me because they're trying to decide on surgery. They don't know what the right next move is. They feel like it maybe is their only option, but they're not 100% sold on it. So if that is you, this is definitely going to be for you. Maybe you've already done surgery. Maybe you've done PT. You've done massage. You've done all the things you can think of, and literally nothing has worked. Or maybe it worked temporarily, but nothing really stuck. That's what we're going to cover today. So this is, you guys are in the right place if you fall into any of these categories. Again, if you are coming from the challenge, you guys just spent basically the past 21 days. I don't know, we haven't exactly hit the 21 days yet, but you've just spent the last couple weeks really paying attention to your hip, right? So you have done sort of, we're going to talk through like the phases, but this is almost like phase zero. It's just learning to listen and understand what's going on in your hip, understanding what your flare patterns are, understanding what your hip is trying to tell you, how to listen to what your hip is saying. And so now we're going to take it one step further. Once you know your pattern, that's awesome. That like I said, it's sort of step zero of figuring out what to do next. But the problem is knowing that isn't enough to really help you understand what do I actually do for it? Like, what are the next steps that I actually need to take? And that's what we're going to talk about today. If you are not coming from the challenge, no big deal. This still is really, really applicable to you. The thing I would say about that is just knowing that sort of where we want to start before we jump into these next phases that we'll go through today is making sure you understand your flare patterns, making sure you understand your hip and what triggers it and what makes it feel better so that you can start to have a plan for how to move forward. So again, even if you haven't already done that, it is okay. I will still, there's lots of ways that I can still walk you through sort of what to do for that. And then the rest of this will be really applicable. So if you guys don't already know me, or if you've never actually formally met me before, other than just through TikTok or Instagram, my name is Dr. Jenna. I am the founder of On Point Wellness and Rehab. I'm located in Gainesville, Virginia, which is like maybe 40 minutes, 45 minutes or so away from Washington, D.C. So I'm up in Northern Virginia. I have had my clinic here for, I think, well, May will be 10 years, which is insane. And over the course of those 10 years, a lot has changed, right? Like I moved from seeing predominantly people in person to now working with people mostly online. I do have a team of people that still sees clients in the clinic. I still see clients in the clinic. But I've really moved more into the online space. And the reason for that is because I can reach so many more of you. There, over and over, the common trend is that there's nobody that can help me. There's nobody that's located near me that does what you do. And that was just unacceptable to me. So I've moved into the online space to allow you guys to have access to the exact same things that I do in the clinic. And we put it into a framework that is, again, it's exactly what I do with all the clients that I work with. And now we can deliver it virtually. And the cool thing is, not only does it work just as well as it does when you come into the clinic, but you can do it sort of on your own time. It takes out some of um, the struggle with scheduling and all that stuff. So that's ultimately why I've gone into this online space. And again, the people that I've worked with have gotten amazing results from doing it this way. So I do want you to know that there's a lot of hope with working with somebody virtually. You don't have to be in front of me to get these same results. Just really quickly too, just so you kind of understand where I'm coming at from the hip injury side of things. My background, I started my clinic as I was a dance, or I am a dance medicine specialist. So I work with professional ballet dancers, amateur and like recreational dancers, all of those things. And as you can probably imagine, they have a lot of hip issues, specifically a lot of labral tears, impingement. We see a lot of dysplasia, hypermobility, like all these things. And just from seeing that so much with my dancers, I honestly just got really well versed in treating the hip. And now it's almost exclusively what I treat. Like I said, we still see dancers in the clinic and we still see everything. But myself, I really have honed in on hips, and whether I'm seeing somebody in person or virtually, that's pretty much all I see these days. And why that's so important is because it gives me a little bit more of a skilled eye than you're going to get from a traditional physical therapist, because I literally stare at hips all day long. So we see some things and we pick up on some things that maybe your other therapists just are not seeing because it's not what they specialize in. And I think it's really important to understand that if you've tried all the things, but you haven't tried specialized therapy for impingement and labral tears, you haven't tried all the things yet. So again, stick with me today because I'm going to hopefully be able to uncover some of the mystery around it and give you guys some idea of like where you need to go moving forward. So first, I want to talk about what is hip impingement, what are labral tears, because I think probably you have heard a little bit about it, but maybe don't have a great understanding of what it actually is. And so I think for me, it's really important that people understand what we're even dealing with. So impingement is sort of there's two sides of impingement. There's a structural impingement and there's a functional impingement. Now, most people focus a lot on the structure side. So a structural impingement, and some of you may have these, but a structural impingement would be something like a cam impingement or a pincer impingement. If any of you guys here know if you have one of those, go ahead and write it in the chat because I'm curious to hear if anybody's been like formally diagnosed. So there's a cam, a pincer. There's also a mix where you can like have a little bit of both. And basically all that means is that, so there's the head of the femur and the socket, right? So this is your hip joint. Sometimes we get extra bony growth on the head of the femur. Sometimes we get extra bony growth on the socket. And that's what we name either a cam or a pincer impingement. It basically just means there's extra bone there so that when the head of the femur goes to glide in the socket, it can't glide as smoothly or it hits bone early in the motion. So there's something sort of structurally getting in the way. So again, if you guys know if you have this, go ahead, pop it in the chat because it's always helps me kind of know if you've been diagnosed with something like this or not. Confirmed labral tear and MRI. Not sure if I had impingement. Okay, yeah. So and we'll talk about the connection to labral tears here in a second, but yeah. So basically, a lot of people have been diagnosed with cam and pincer impingements. Now, even if you've had an MRI or an X-ray and you've been diagnosed with one of these things, keep in mind all that shows you is the structure. It doesn't show you how you move. So remember I said there's two different types. There's structural, which is what would show on an image, and then there's something we call functional. Functional impingement is how you're moving. And are you getting pinching or compression in the front of, usually the front of that socket? You can also have a posterior impingement. I'm going to stick to the anterior impingement just because this is what most people have. It's a little bit more common, but so you can get this impingement on the front side of the joint when things and the muscles around it aren't stabilizing and moving properly. So again, the head of the femur still doesn't glide correctly in the socket. So what happens with again, either a structural or functional is sometimes so when let's pretend I'm flexing my hip. So flexing is like I'm bringing my knee closer to my chest. So when I flex my joint, what's supposed to happen is the head of that femur has to kind of glide in the socket. And no matter what way you move, there's gliding that has to happen. It's not something we can feel from the outside. It's just internally what's got to happen. Sometimes that gliding isn't happening, or it's not happening smoothly, or it's if it's not happening, again, we get this compression. So like when I flex my hip, I've got to have this like downward glide in the socket basically. When it doesn't, it rides too far forward, it compresses. Now, if I've got a structural impingement, that compression is going to happen really early in the movement because there's something physically blocking it. If I have no structural problems, but I have a functional problem, I can still have the same issue because the muscles around the joint aren't stabilizing and allowing that movement and gliding to happen the way that it's supposed to. Now, it can be a problem with stability. It can be a problem with mobility. Sometimes the joint mobility isn't where we need it to be, or it's not flexible enough. Most of the time, what I find is it's a little bit of a combination of both. And it's hard to say what came first, but usually there's a little bit of mobility restriction. There's also a little bit of stabilization issues. Again, this is also why it's really common, something we really, really often see in somebody that has like hypermobility or dysplasia, because we don't have good stability at the joint. And that functional piece of impingement, that's the piece that I think is very often overlooked. So again, if you're somebody who's been diagnosed with, I have a structural impingement, I have a problem, very often you're going to go into the surgeon or you're going to see things online or whatever it is, and they're going to say, you've got to have surgery. You got to have the structure removed and taken out. And while sometimes that is the case, what I would argue is that most people that have a structural hip impingement also have a functional hip impingement component, meaning, yes, there may be something diagnosable on the MRI. There might be a cam or a pincer impingement. However, you're probably also moving in a way that's making that impingement worse. So you're getting too much compression. Most of the time, it's going to happen like on the front side of the joint, which is that classic catching, pinching, deep groin pain, deep joint pain that you'll often feel. So the issue is that I don't think most of the time people are dealing with how you move. And if you don't deal with how you move, even if you have a surgery to fix the structure, you are still going to end up having a problem on the back end. And this is why so many people are like, I've done surgery 6 months out and like I'm still in pain, or I'm in more pain than I was before. And if you're thinking about having surgery, it's really important to understand this, because you have to understand that unless you address the movement and the function, the surgery itself is not going to be the thing that cures everything. Have any of you guys had surgery, or are you considering having surgery? Again, I'd love to know kind of where everybody's at in their own journey. So just write in the chat if you've had surgery. Just write surgery. If you're thinking about it, write thinking about it, because I like to know where people are sort of at in their own journey. But yeah, so that's basically what hip impingement is. We get too much forward glide in the socket, and we get compression most of the time on the front part of the socket. And that's what leads to those classic impingement symptoms, the pinching, the popping, the catching, all of that. As far as labral tears, now labral tears and hip impingement, they go hand in hand. The reason they go hand in hand, so the inside of the socket here, so we got the hip joint again. Also, I'm not gonna lie, guys, I have a hip model, and because I'm filming this in my playroom today, I totally forgot the hip model at the office. So I'm so sorry I don't have it, but my hands will work, right? So again, we have the head of the femur that sits in the socket. On the inside of that socket, that's what your labrum is. It's the ring of cartilage that protects the head of the femur in the socket and makes sure that there's enough space there. It kind of deepens the socket a little bit, so it like holds the head of the femur in there, creates some extra stability. And on the front side of the socket, so the anterior portion of your joint, that's where it's the most exposed, and there's the least amount of sort of bony coverage, just based on the normal natural shape of the hip joint. And so what often happens is when we get that tendency for the head of the femur to not stay centered in the socket, so it kind of rides forward and up a little bit, it pinches, or impinges on the front part of the joint, which is where the labrum is. And that repetitive irritation over time with improper movement patterns, possibly some structural, influence there as well. It actually causes the labrum to start to wear down and the fraying and tearing happens. Now, most of the time, people have these labral tears that are sort of like a gradual progressive thing. So they kind of like gradual friction and wearing away like over time. There is the case though where it can be like a one-time thing. So if, in athletics, we see it a lot, in my dancers, one big kick or something like that, like a really forceful movement, one time can be enough to have a labral tear. But what I find is most of the time it's this repetitive use pattern. And again, this very much plays into the impingement. So a lot of people are like, I have a labral tear, but I don't know if I have impingement. And often, if you have a labral tear, there's some level of impingement happening there. You just might have never been diagnosed with it if there wasn't a structural impingement. But really, impingement is a pretty blanket term for any sort of symptom, like on the front side, if you're getting pinching, catching, popping, clicking, anything like that, deep groin pain, like that's basically impingement. So it's not just the structural part. In fact, many people have a structural issue and still have never even been diagnosed with impingement because it's not the structure itself that is the only thing that diagnoses it. So hopefully that makes sense. But yeah, so I see a little bit of a mix. I have so no surgery, still really undecided. That's super common, Kristen. I hear you. You are not alone in that. I would say the majority of the people I work with are in the exact same boat. So you are in the right place. And hopefully we'll give you a little bit of clarity today. Having a checkup this week after the injection. Yep. So injections are really common for this as well. To see if surgery is recommended. Yeah, often they'll do injections in these areas. So we also, with labral tears, obviously one of the courses of action is to have surgery done. Now, there's different types of surgeries. There's labral repair surgeries, which they don't do quite as common anymore. The recovery rates and the success rates aren't super high there. So a lot of surgeons don't do these anymore. Back when I started doing this, 14, 15 years ago, they were really common. Long recovery, like they were just a lot harder to come back from. Now, most of the time when they're doing surgeries, they're just doing an arthroscopic surgery where they go in and they just like shave down the bone. So the part that was structural, the cam or the pincer impingement, and they also shave down the labrum so that, because basically what happens is when it tears in there, it's like kind of like a little hangnail on the inside. So they go in and they shave that part down so it doesn't keep getting caught. So yeah, I mean, one of the courses of action for a labral tear is obviously to have surgery, but we can't say in many of the times the labral tear is not the source of people's pain. And the reason that we know this is because they do research studies all the time where they'll basically take MRIs of people that have zero symptoms. So no hip pain, no impingement symptoms, nothing. And they'll take MRIs, and 60 to 70% of those people, their MRI will come back with a diagnosable problem. Labral tear, impingements, the cam or the pincer impingements, all these types of things. But these people have zero symptoms. So what that tells us is that you can live with these structural impingements. You can live with a labral tear. You don't have to have surgery. And very often people end up having surgery for it because that's just what they're given as an option, but it doesn't make things better if the pain wasn't coming from the labral tear. That wasn't the source of their problem. The source of their problem was how they were moving, which was creating too much compression and, irritation in the joint. That's the piece, like I mentioned before, we have to address no matter what, with or without surgery. So when you're on the fence about surgery, what I generally tell people is do as much as you can conservatively first, max that out, and then if nothing has made it better, then you opt to have the surgery. And the reason for that is because the worst that's going to happen if you do all the PT and you learn the movement re-education, and when I say PT, I'm talking good specialized PT with somebody who understands this, and it still doesn't make it better, then you have the surgery, right? But again, the worst that will happen there is now you're going into that surgery understanding hopefully having a lower, pain threshold to begin with, but also understanding how do I move, what is happening in my hip. So on the other side of surgery, I am going to recover faster, stronger, all of those things. So, um, and I can go off on tangents. So I kind of lost my train of thought on that. However, I was talking about the injections. So the reason that that is important is because they will often do the injection to see, they'll do it kind of in the joint to see, is the labral tear the source of the problem? If you have the injection, it takes all of your pain away, and they did it, kind of inside of the joint, then we can say, okay, so it seems like your pain is coming from the labral tear. So then surgery may be a better option for you. Still got to learn the movement piece, but it might be a more successful option for you versus somebody that has the injection and absolutely nothing changes. That tells us it's probably not the tear. It's probably something else. It's probably the way you're moving, stabilizing, all of that. So hopefully that makes a little bit more sense of like what is actually happening in the joint, because this is going to be really important for what do we do to fix it. So if you guys are coming from the challenge, I hope that what you've realized up to this point is that your pain isn't random, even though it feels like it's random at times and it seems like there's no rhyme or reason to it. When you actually start tracking it, patterns emerge. There's generally something, there's a flare type, maybe it's a tension related problem, maybe it's a structure or stability related problem. Maybe it's certain movements that you're doing certain times of day. Like there's so many patterns. You just have to figure out what is yours. And so if we know that pain isn't random and we start to figure out, okay, what are my patterns? What you also need to realize is your recovery path shouldn't be random either. And again, this is exactly why I see so many people, quote unquote, fail, whether it's PT, surgery, whatever. And it's because nobody has ever laid out a framework of how to move forward. You just end up doing these like random bits and pieces of things. And so we are going to talk today. The next piece of this is going to walk you through the exact framework that I use with my clients to take them out of that flare up cycle. Most of the time, the reason people keep getting stuck is because they're doing a very random rehab process, and that just doesn't work. So we have to have a good strategy behind it. And today you're going to learn the strategy that makes this so successful for all of my clients. So what this looks like, there are 4 phases in this recovery process. So I kind of mentioned that phase 0 was like learning your patterns and understanding your hip. It kind of comes like before this or simultaneously with phase 1. So know that while I have these sectioned off into categories, there's a lot of overlap between these things. And it doesn't necessarily mean that like you just fall into one phase at a time. There's going to be a lot of overlap. But understanding your patterns, understanding what triggers you, understanding what eases your pain, that's going to be really important because phase 1 is calming the system. Phase 2 is optimizing your movement patterns. Phase 3 is rebuilding your strength. And phase 4 is elevating your performance. So I call this the core framework. So we are going to walk through exactly what this framework looks like. I'm going to teach you how I do this with people. So phase 1, again, is calming the system. So as you can see, I kind of included here some of what goes into this phase is learning what is going on in your hip. So having a sense, an idea of what triggers it, what relieves it. Again, if you guys already did the 21-day challenge or you're in the process of the 21-day challenge, this is exactly what you've been doing. You've been working sort of in this like early phase 0, phase 1 of this whole process. And the idea with phase 1 is we have to figure out how do we calm down what your hip is feeling? How do we make the symptoms less prevalent? How do we reduce reactivity? So what reactivity means is how your system, how your body, how your brain reacts to what you're feeling. So that can often be things like, when you feel pain, like what's the first thing that happens when we feel pain? We tense and we guard, right? Our body's trying to protect us from the pain that it feels. Our brain doesn't want to feel pain. So it tries to figure out, how can I protect? We go into this fight or flight, pattern. Maybe there's some anxiety going on there. Again, nothing you're doing wrong, but it's just what our body does naturally to protect us. So the way that we react to that input of pain. Now, the goal isn't just eliminating pain here. We obviously want to get it to a point where it's less reactive, less painful, less symptomatic, for sure. But the other thing that we are trying to do is start to rebuild trust in your hip again. So if you guys have been struggling with pain for a while, you probably know you might be at a little bit of a point where you don't really trust your body anymore. You're kind of probably wake up every morning and the first thing on your mind is your hip and um, how's my hip going to handle the day? Maybe you have some, big plans, things you want to do. You want to go take a hike with your friends. You want to go for a bike ride. You like whatever it is. And the first thing that then comes to your mind is, I don't know if I can my hip won't let me do those things. And you start to lose hope essentially, right? Like your body, you don't trust your hip. You don't trust that your hip can handle the day-to-day demands of life, but also like all the things that you love and want to do and probably have built your identity around. I know a lot of you guys probably identify as active people. And when your hip hurts every single day, it chips away at your trust and your sense of identity of like who you are, right? And that sucks and it's hard and it's exhausting. And so until we address that that's happening and we find a way to calm the body around and the system around that, it's really hard to move into these other phases. You can go to PT and you can go get stronger, but if you don't address that this mentally is happening, physically what's happening around your pain, it's really hard to move forward. And so this phase, it's so, so crucial. So what are the types of things that we would do in this phase? It's going to vary person to person. And again, if you've done the 21-day challenge, you're working through it, it's starting to give you some of that idea, right? So it's starting to give you, hey, here's some suggestions. When I feel this way, here's my flare up plan. We call it the playbook. Here's the playbook of what I'm going to try. Maybe it's deep breathing because I recognize that there's a lot of tension around the pain that I feel. And so when I do diaphragmatic breathing, my body starts to relax and feel better, and I actually have less pain. Perfect. That's one of your go to exercises then to get yourself out of pain and reactivity. Maybe it is some gentle range of motion. That hands and knees rock backs is a great exercise to just reintroduce some calming movement to the hips. So there's a lot of different exercises that we would do. The goal is, though, it has to be custom to you. And again, this is why it's crucial that you're with somebody who specializes in this, because going into PT where they're seeing 5 patients at once and they're just handing out cookie cutter exercises, this is not going to get you where you need to be. You need to know what are my flare patterns and which exercises are targeting those flare patterns so that I can get myself out of this. So again, there's a lot of exercises. Target them to you. Most common mistakes I see are that they're not targeted things. And then the other thing is, I kind of already mentioned this, but that people just jump straight into strengthening or mobility or, you just jump too far forward and you never address this. The other thing that we've got here, right? Your hip it's playing defense. It's literally in fight or flight. It's been under threat. It doesn't know. There could be a bear chasing you for all your body knows, right? There's not, but it perceives it that way. And whether it's hip pain or a threatening movement like squatting, maybe squatting's the threatening movement for you, like it brings on pain every single time, or a bear chasing you, your brain doesn't know the difference. So it brings you into that same fight or flight pattern. And we've got to chill your nervous system out. We have to calm it. If it's not calm, it's very hard to move forward. So yeah, I see some people, my hip problem has defined my whole year. Yeah, I get it, Kristen. Like this, again, this is like what people tell me day in and day out. You are not alone in that. First of all, I think that is one of the most common things that I hear with this problem. It doesn't have to define you though. And that is what's so great about this. It's just, again, nobody's probably showed you this framework of like, what do I actually do to move forward? So that is the C phase. Phase 2 is or actually I have it's optimizing movement. I've got the wrong word there. Ooh, sorry. It is the core framework. So the O is optimize movement. So this phase, so we're getting to a point now where your body is starting to feel a little less threat. It's starting to trust your hip a little bit. Maybe there's still some pain. It doesn't mean you're 100% pain free, but you understand your patterns and you're starting to understand what makes my hip feel better. So we're kind of on the upswing, right? And that's why I say there's a lot of crossover between these. It doesn't mean that you're 100% pain free before you move into this. I would say most people start to move into this optimizing movement phase within the first like 2, maybe 3 weeks. So we're getting there quickly, hopefully, but that also means you probably are still having some pain. So what's the goal of this phase? This phase is learning how to move. So making sure that you're moving with good patterns. Now, again, this is the piece that I would say is the number one thing that gets skipped over in traditional physical therapy or programs that you maybe have tried in the past. We skip over how to move, and we can't skip over how to move. You have to understand how to move. So what is happening in this phase? Basically, this is where we are identifying, well, what are your movement compensations? Is it a strength problem? Is it we're not stabilizing correctly? Is it mobility? What combination of those things is it? What muscles might be the problem? And then we are retraining how you move. Now, we know that people with hip impingement, there are some common patterns that we see. Everybody is different. Everyone has their own unique patterns. However, again, I've been doing this for 14 years at this point. The thing that I can tell you that I see that most other PTs or people that you've probably worked with don't see is the nuances of how you're moving. How you're moving is the functional piece of the impingement. And if nobody has ever looked at that, you are not going to get anywhere. You can go to physical therapy and you can get stronger and you can do all the exercises. But if they haven't actually broken it down and showed you, here's how you find this muscle, here's how you activate it, here's how you do the squat or the bridge or the clam or whatever it is, and you don't even know what you're supposed to be feeling, the strength doesn't matter because you're not strengthening the right stuff. You're not strengthening the pattern that's going to get you out of the problem. This is retraining the functional piece of the impingement that's keeping you stuck in that loop, right? So again, brief anatomy overview here, but when your hip joint moves, so in the socket, I say flexion. So flexion again, meaning like anytime the knee comes closer to the chest. So it could be squatting down, getting up and down from a chair. That's a flexed position. It could be lifting up your foot to go up a stair or to put on a shoe or put on your pair of pants, something like that. Like that's all flexion. And the reason I'm talking flexion is because for most people, this is the thing that reproduces the pain the most. Not everybody, but we'll use it as our example. So when I flex my hip joint, it has to, like I mentioned, it has to glide down and back into that socket. When that down and back glide doesn't happen, it rides forward, it gives the compression on the front side of the joint, and we end up with the impingement and the pain. So if I don't teach you, how do you not do that? How do you keep the head of the femur centered in the socket? Your squat is still going to hurt every single time you try it. So now you have people telling you, well, you got to do squats and you got to get stronger and you got to strengthen your glutes and do all of this and that. But nobody's ever showed you, how do I make sure that I'm not impinging while I do those things? Number one, you're probably still going to have pain. Number two, you're probably not actually going to build effective strength because you're only going to be able to get so far and then your hip's going to tell you no because it's not moving efficiently. So the more efficient we move, the stronger that we can get. And this comes down to, there's a lot of muscles that we have to look at. There is the deep hip rotators, the glute muscles, the hip flexors. There's a lot happening. But where your imbalances are and what needs to be worked on, that's just going to be customized to you because everybody is a little different. Common things that we need to address, but at the end, everybody is a bit different. So again, the most common mistakes here are that people they don't change the way they move. And so they jump into the strengthening. And essentially what happens is you end up strengthening the compensation instead of the proper movement pattern. So again, if we walk through these phases again, phase one was kind of understanding what's happening in your hip and how to start to calm the symptoms. As we start to get that feeling like it's under a bit more control, pain is starting to come down, we're then starting to learn how do I move with good patterns? That's going to continue to get that pain level down and help you start to feel like you're doing some stuff again. By the time we get to phase three, pain should be not gone, but it should be much more mild at this point, much more or much less frequent. And now, once we know, okay, you're moving with good patterns, now we're going to load them up. Now we're going to start rebuilding strength. And this essentially is the piece that I think most of the time gets jumped to, but none of that foundational stuff happened first. Once you lay the foundations, now when I start going into my strength building program, I'm going to see effective strength. I'm actually going to see it correlate to a continued decrease in pain. I'm going to see it correlate to the goal, the long-term goals that I have. I'm going to see it actually get stronger versus plateau and stay the same forever. And hopefully at this point, you're also not having to continuously modify and adjust everything that you're doing. There's probably still going to be some modifications, but because the pain is better, you should be able to physically be doing more by the time you get to this phase. So we are layering load and resistance on top of these already established good movement patterns. And this is where you're going to ultimately see that the changes really start taking shape. I think it's really important here to note that there's also a strategy all of its own in how you're going to rebuild strength. So we need to be paying attention to appropriately dosing your exercises. There's not a magic exercise. I'm a firm believer there's no magic exercise because it depends on your situation and it depends on your imbalances and all of that. However, the principles of strength conditioning are the principles. There are things like progressive overload where we know we need to gradually reintroduce load in a way that the body can handle and adapt without it flaring up again and setting you back. There is, making sure that we're still modifying and adjusting movements that maybe still do trigger your symptoms, but strengthening the things that don't trigger it, or adjusting how you're doing an exercise. Maybe what type of resistance you're using, bands, dumbbells, barbells. Like there's so many different ways and that we can get the result we're looking for. But at the end of the day, the thing that has to happen is you have to challenge your body in a way that allows it to adapt and get stronger. So that's just kind of some of the stuff that goes into this phase. And again, unfortunately, I think that many times when you go to traditional physical therapy, they're not great at the strength building part. And so they just throw random exercises at you. You have no idea why you're doing these exercises. They're not really helping. There's no rhyme or reason to like how you progress them or what they're for or what goal they're attached to. And again, random rehab is going to give you random results. So if you want to actually see the progress happen and accumulate over time, you have to have strategy behind not only the whole thing, but within each of these phases, there has to be strategy behind it. So if you've been doing PT and you can't, your therapist has not explained this to you, I would strongly urge you to either get an explanation or find somebody who can give you one. So that is the strength building phase. The last phase is elevating performance, which essentially is just returning back to life. So this is the point where people really start to feel like, okay, there is a change, there is a difference. Now, again, you should hopefully be feeling the difference the entire way you're working through this strategy. But this is the point when people are like, you know what? I don't wake up and think about my hip first thing in the morning anymore. You know what? I did go for a hike yesterday and it didn't bother me. Oh yeah, maybe I sat for a little and it was a little uncomfortable, but like it went away within an like these are the things that start to happen when you get to this phase where it's no longer controlling your every move anymore. You are in control of it. So yes, maybe there's a point where that pain will like start to threaten to come back on, but because of all the work that you've done leading up to this point, you know exactly what your body needs. And that threatening feeling of, oh, maybe there's going to be a flare, you are like, nope, I'm not going to spiral. I'm just going to do all the things that have worked and I know have worked for my body. And it makes it so that it never actually turns into a flare up. And this is real, like this can happen for you. And I know it doesn't feel like it can happen. It probably feels like it's so far off, but I will tell you, this is the point that every single one of my clients gets to. They have to get to, because if you don't get to this phase and you just stop at pain free, you are missing a, really, I would argue, the entire point. Pain free is not going to get you back your life. Yes, it is fabulous to be pain free. It's going to get you back, being able to do things, but it's not going to give you back your life long term. So, so yes, a maintenance program, Lynn, exactly. So what this essentially looks like is, once we get to pain free, it's kind of like that's my starting point. Now I can really start to build on the strength. Now I can start to take all the programming that we were building in those early phases and make sure that it's fitting into my life. So maybe it looks like a strength and conditioning program that you're going to go to the gym and you're going to go work on. Maybe it looks like getting back into whatever the sport that you were doing. Maybe it was dancing, maybe it was hiking, maybe it was, playing pickleball, like all these different things. You're starting to re-implement all of those types of things. You're still doing all the stuff that got you to this point. So we know, there's work to get to this last phase. You can't just stop all that work. You got to keep doing the things that got you there. But it should at this point start to feel like I'm doing it because I'm staying active, not because it's PT or because it's rehab or because my hip even hurts. I think part of the reason most people stop when they get here, when they stop when they get to pain free, is because they're like, well, I'm pain free, so like I don't have to do those things anymore. But what you forget is all those things are what got you pain free. So we have to keep doing them, and they're going to morph and they're going to progress and they're going to look different. But now it should just be, I'm back to my old active lifestyle that I've been missing, and I'm doing it in a way that is keeping my hip health important and kind of forefront. If you are somebody that is, again, you're on the fence about surgery, there's going to be work no matter what. Surgery is not the easy way out, right? Like there's a whole lot of work that goes into recovery after surgery, but there's also a whole lot of work that goes into not having surgery and doing this conservatively. So truly, if you're trying to make that decision, I think it's extremely important to manage your expectations that either way, you're going to have to dedicate some time to this and you're going to have to put in some work. My job is to help that work not feel like work. And it just feels like I'm just going to be my normal active self, and it's going to work in all the stuff that I know my hip needs. So when I say this stuff, it's not because I want to overwhelm you or make it feel daunting. It's actually the complete opposite. It's because I want you to realize that this can just be part of your life, and it never has to feel like an extra thing that you have to worry about doing. All right. So those are the phases, guys. My 4 phase framework, the core framework. So phase 0, awareness. Phase 1, calm. Phase 2, movement. Phase 3, strength. Phase 4, back to life. Again, if you came in from the challenge, you are working in this phase like 0 to 1 right now. You're kind of working in there right now. I'm curious, where would you guys put yourselves on the schedule? Just give me a number in the chat. Do you feel like you've already done some of this work? Where would you put yourself on this scale? Or whatever feedback you have. Is there a phase that you feel like you've tried? Or, you've tried PT or whatever it is. Is there a phase you feel like was completely missed in your rehab? Did you do the calming stage? Did you do the rebuilding movement phase? Did something feel like it was missing in your journey right now? So between phase 1 and 2, yeah, and that's a great place to be. You're still at that building block phase, Lynn. You're in a place where you can start to lay the foundation for how the long-term change is going to happen. So it's a great place to be. Even though it can feel frustrating if you're still feeling pain, it's not going to be that way forever, as long as you stick to the framework. So let's talk about kind of the reality behind this, though. Knowing these phases and figuring out what am I going to do in these phases are really two different things. Again, awareness it's a big piece of the puzzle. You just have to even be aware that like these phases exist. actually walking through what to do in each phase, that's where it can get a bit confusing. And this is where I feel like, again, a lot of people struggle because their rehab becomes very random. They just try to find exercises like, okay, I know that I need to work on calming my system. So I'm going to go online. I'm going to ask ChatGPT, give me the best calming exercises, for my hip or whatever. And it's just going to give you random things to try. The problem is none of those things are customized to you. And so when you get, again, I'll say it again, random rehab, random results. If you're just trying to piece this together on your own, can you do it? Yes. Is it going to take you longer? Also, yes. And there is an easier path forward and there is a more streamlined way to get there. So this is kind of what I want to move in and talk to you guys about. Before I do, let's see. I see Kristen, I've tried traditional PT and it did nothing. Did go to more exercise minded, love it. Need to strengthen areas around the labrum, take pressure off. Perfect. So, and yes, that is absolutely true. An exercise minded PT, like fitness forward PT, as we'll call them, is I think really important. Again, though, there's still sometimes that gap of I just feel like I need to do more strength, but I don't really know what I need to do for my body. And not understanding why you're doing what you're doing or how to do it is still going to create an issue. If you have somebody that's walking you through that, then you're going to be in a much better position. So this kind of brings me to the final part here, which is my answer to how to help you guys with this. The reality is every single one of my clients that I see, they sort of end up finding me as a last resort, meaning they've tried the traditional PT, they tried going through their insurance, they tried the surgery, they tried the injections, they tried the massage therapist, they tried the personal trainer, they've done all the things, and nothing has worked. And then they find me, which is awesome. I love that they still find me, but then they start to get better a lot quicker. Wouldn't it be great if you could just skip all the stuff that didn't work and just get to the stuff that does work? And so that is where this group coaching program comes in. So basically what we did is I created this framework that I've essentially just walked you through, and we've put it into a group coaching program. Before, the only way to work with me was to do it one-on-one or do it through my online program, which was called the Hip Lab. The feedback from the people that did the Hip Lab, well, they got amazing results. We've had a lot of people go through it. It was is a great program, but the feedback was, I wish I had a little more guidance and I wish I had a little more connection. The thing is, with those self-paced programs, you have to implement it yourself. I'll give you the information, you implement it. And then we have, on the other end, we have one-on-one programs where it is all guided by me. And sometimes that means a bigger time commitment, a bigger financial commitment. So we needed something right in the middle. So that is why I built the Hip Lab VIP, which I'm so excited about. We've already got a few people in it, so there's not a ton of spots left, but let me walk you through what it is, and you guys can figure out if this will be the right next step for you. I would say it probably is the next right step, but let's talk through what it is. So essentially, this is an 8-week coaching program. You get to work with me. I'm going to walk you through all 4 phases. And so the idea is you get the support, the accountability. You still have to go do the stuff, but I'm going to help you through it. I'm going to tell you what to do. And you get the community of all the other people in the group at the same time. This is a really lonely road sometimes. This is a process that can feel like you slowly are losing a piece of yourself. You're losing your hope. You're losing your community in a lot of instances. Maybe that running group that you were a part of, or your social circle, you're afraid to go out and do those things with those people because it hurts. And you start to lose even your sense of community. And that is not what we want. That's not what you need. You need to surround yourself by people who understand what you're going through and can help lift you up. And that's the piece of this program that I am most excited to bring to you guys. So in the coaching program, essentially what it's going to be is you're going to understand what's happening in your hip. You are going to understand which phase. Well, we're going to walk through all the phases, but you'll start to understand like what phase am I in and what do I need to do in that phase that's custom to me? How do you actually start to reduce the flare-ups in a way that that they go away and stay away? Maybe, again, maybe some little ups and downs, but you start to understand how to respond to my body when I'm having a flare up. You're also going to learn how to actually take this and build it into a program that works for you. So I think I saw somebody write that like I never know, I'm always scared I'm going to make it worse, right? I don't know. I'm afraid of doing exercises and making it worse. Oh, I see, Kristen, it was you. So I'm afraid of doing exercises and making it worse. We're going to walk through so that that doesn't happen. I'm going to walk you through how do I progressively overload safely? How do I make sure I'm using good movement patterns? All of that. And the idea here is to give you back some confidence. Not only will you understand your hip better than you've ever understood it before, but you're finally going to understand what do you do for your hip moving forward. And that confidence is everything, you guys. So inside of the program, basically what it's going to look like is there's going to be a weekly group coaching call. So on Thursdays at 12:30 Eastern, you basically will put it on your calendar. It's your standing appointment with me. And we are going to jump on a call live, all of us together. And this is when you get eyes on your specific situation. This is when you will, there's going to be weekly content that you'll be able to watch kind of throughout the week. You'll have some exercises to do, all of that. And then we'll hop on these calls and I will coach you through any problems that you're having. Something doesn't feel right. You have a question on something, you don't know where to start. Like all of this, you come on these calls, you ask your questions and you get them answered. And the really cool part about this, again, the community aspect means that everybody's going to have questions and they're all going to bring them into the group. And so not only do you get coached on your question, but you get to hear me coach the other people on their situations and their questions. My guess is most of you have really similar questions and really similar things that you're experiencing. And so you get to learn all of that knowledge on these calls. But ultimately, these calls are also what will start to make the program a bit more custom for you versus just a cookie cutter program that everybody is doing. So again, you'll get the full access to the full core framework, me to walk alongside of it. Alongside with the community, not only will it be on the calls, but there is a group forum that is private. So you guys have access to each other to share your wins, your frustrations, lift each other up, stay in contact with each other. Better than the Reddit forums. Okay. I know I've seen the Reddit threads. It's a scary place to be, guys. Let's keep it to a place that is a little more positive. So that's what you will get out of this. And again, you're not doing it alone. That's the most important piece. No more of this random, I'm grabbing things off ChatGPT and Instagram and TikTok and putting them all together. Like, no, we are going to do this together. You have my support, you have the group support, and we're going to walk through it all together to get you better. So my goal for everybody that goes through this program is by the end, you will have a better understanding of your hip than an entry-level clinician. So a physical therapist that has just come out of school, you will have a better understanding of your hip than that new grad physical therapist will. And it is possible. This is why my clients get better, because they understand their hip. They understand how to adjust when something goes wrong. They understand how to progress, what to do when things are going well, what to do when things are not going so well. That's what you're going to learn. So is it right for you? How do you know? Because it is an investment and you have to, let's face it, you guys have already tried everything and it hasn't worked. So why would this work? So let's talk it through. If you've already completed the hip reset challenge or you're in the middle of it and you have found that piece helpful, this is the next best step for you. This is okay, I know what, now I'm going to figure out how. If you are at a point where you feel like you've been coasting the past year, right? Like coasting is probably not the right word. You've just been like stagnant, plateaued, trying to like just break even and you're done managing, but you actually want progress. This is your next step. If you want guidance, not from even me on YouTube or TikTok or whatever, but you want my honest feedback, real-time guidance, this is your next best step. And if you want the community of people who get to do it alongside of you, this is your spot, guys. I'm telling you, this is going to be life-changing. I will say, because there are cases where this is not going to be the right thing. If you are somebody that does need one-on-one clinical care, so if your pain is so great that and so much that like you can't work through any movements, you're probably going to be better off seeing somebody in person, one-on-one care. If you have like really acute sort of symptoms and inflammation, you probably are going to need actual physical therapy, because this isn't physical therapy, it's coaching. Can it work alongside physical therapy? 100%. It does. It will fill in the gaps that you're not getting in PT. But there is this situation where sometimes the pain is so much that like you just need hands-on care. So if that's you, this is probably not your program. Um, if you are looking for a plug and play exercise program where you just pop it open and that's what it says to do, this is not for you, because I'm going to walk you through you have to understand this. That is what changes it for you long term, you understanding. So it's not just here's the exercises she tells me to go do them and I do them. You're going to be part of this process. If you're ready for that, then this program is for you. And if you don't feel like committing to 8 weeks is the next best step for you, then I wouldn't suggest it. The reason that we do 8 weeks is because we know it takes at least 8 weeks to make real changes in your body. So I am going to commit all of myself to you guys. You have to commit back to me, be accountable for these next 8 weeks. And if you do, I promise you, it's going to completely change your life. So what does it all look like? The program is, again, it's an 8-week program. I am only accepting 12 into the group. There are currently only 8 spots left. So we are already filling spots. The group starts on this Thursday, which is the 16th. Yep, the 16th. The first call is at 12:30 Eastern. Do not worry if you cannot make the calls. They will all be recorded. So you'll still have access to everything. Every week, you will still have access to there'll be educational content you get every week. You've got your exercises every week. So the group calls are not the only piece of this. Don't let that be your determining factor. The program investment is $997. That is, again, for your whole 8 weeks. And special bonus, if anybody is like, yep, this is for me, I know I'm in. If you join during the call, you will get an additional 30-minute one-on-one private call with me. So this is where you get to ask all of your questions. You get me undivided attention for 30 minutes. And that is only good for the duration of this webinar. So if you are even considering doing it, now's your time to jump in. That QR code is where you can sign up and get yourself registered. It will take you through an application process. I want you guys to know I am not taking everybody into this program. I truly want I want it to be the right next step for your situation. So the application process, just a few questions to figure out if I think you'd be a good fit for it. And if you are, then you'll be accepted in. But it's really important to me that this is the right next step for each of you guys. I'm not just taking everybody into it. I want to give you guys a couple real stories from people, because I know, again, you've already tried everything and what really makes this different. So let's talk through a little bit of like real success stories that my clients have had. So Stephanie was one of them, and she actually was somebody that went through my the Hip Lab, the self-paced course, and then did a little bit of one-to-one with me before this group program existed. And so she was one of the people that was like, hey, community would be great. So she helped build this a little bit. But she was having pain for a couple months when she came into my world, and nothing had helped. Just 3 weeks into the Hip Lab, and she was not having any pain anymore. That's pretty incredible. Pain for months, and all it took was 3 weeks of some consistency and learning to understand her hip, and she didn't have pain anymore. Now, is that where we stopped? No, she still had more places. Like pain is, I said it before, pain is not the finish line, it's the starting line. So there was more that had to happen, and it did. But it didn't take that long for her to actually get a handle on what was going on in her body, as long as she just was the missing piece of the puzzle was having the strategy. And that's all she needed. And that's probably what a lot of you guys need. That's the piece that will change everything. And so she was somebody that was able to avoid needing surgery, and she's been managing conservatively ever since. Kate is one of my one-to-one clients that I work with. And her feedback has been that her pain, we've been working together for a few weeks, her pain isn't completely gone, but the difference is that she's understanding what's actually happening in her hip, and she knows what to do to calm it down immediately when it starts hurting. So no longer does she have the big crazy flare-ups that last 3 weeks. Maybe they last a couple hours, and she's able to reverse that. And they've gotten fewer and fewer and far between as we've gone along, because the strategy works. So this is the thing that's finally made it stick for her. And then Anne, it was someone who was having a lot of pain specifically when she was squatting. So she's a teacher, and so having to like get up and down from the ground was a big struggle for her. And she got herself to the point as we worked through that calming phase, relearning movement, and we started building strength. She couldn't even do one squat when we started. And a few weeks later, she was doing 2 sets of 20 squats every single day, no pain, on top of the functional piece that she was actually able to teach and get up and down from the ground with her kids, right? It's not just that she could do the squats for exercise, but she could do it in relation to the actual goal that she had. So I'm sharing these stories with you guys because I want you to know, I know that you're probably feeling a little lost, a little hopeless. There is hope, and these are real stories of people that have been able to get there. I will flat out tell you that I will never guarantee you 100% pain relief. I can't do that. And truly, if somebody is guaranteeing you 100% pain relief, I'd probably run the other way. There's just too many variables that go into it, right? What I can guarantee you, though, with this program is that you will absolutely understand your hip better than anyone has ever taught you. That's the difference between doing physical therapy and coaching. Coaching is giving you the tools that you need to make this better for yourself, and then having somebody alongside of you to guide you through that process versus, hey, just do these rehab exercises and we'll get you out of here. That's not what we're doing here, right? We already know that doesn't work. You've tried it. It doesn't work. It's time for something different. So I'm going to be your coach. I'm not going to be your physical therapist. And I promise you it's going to make all the difference. So what questions do you guys have? I kind of already answered. Some of the big questions people have are like, what if I can't make the live calls? Again, you will have access to all the recordings. I should also add there too, you can still submit your questions. So even if you can't come to the live call, you submit your question, we'll record the calls. You'll have access to the recording so you can still hear the answer for whatever question you had. If I've been told that I need surgery, will this work? Yes, absolutely. Because again, even if surgery does need to be the outcome, this is all the stuff you have to learn anyway. So the goal is that hopefully you do this and you don't need surgery on the other side. But again, I can't guarantee that for you. But if you have to have the surgery, now you've just done all the stuff you're going to have to do anyway. And I promise you, I can guarantee you, your recovery is going to be easier on the other side. And I think I addressed that one. If I've already tried PT and it didn't work, how is this different? Well, hopefully by this point you understand why, but this is a lot different than traditional PT. And I think you're gonna see the difference in the results. So I see a question over here. I've had success with PT. Awesome. I love it to hear it. Just started balance classes at the gym. Love it. Want to build on this for a bit. Is another hip lab starting soon? Let's see, Lynn, are you talking about when is the group starting, or when is, like, are we doing another self-paced option? The self-paced option, again, it kind of converted over into the group coaching instead. If you want to join self-paced, it is still an option. That for the pricing on that, it's $300, well, it's $299. You can absolutely still purchase the hip lab and work through it yourself. Just know that within that, you are getting exercise suggestions, but it is not custom built for you. So if you're looking for more of a built out program for your situation, that's where you essentially do the hip lab, the hip lab VIP. You get access to the hip lab. So the hip lab as it was is actually going to be going away after the 16th. You'll be able to purchase it. The $299 will be available for purchase up until Thursday. Once the group starts, that program will no longer exist and it will be converted over into the group program. The group program, you have access to everything that was or that is inside of the hip lab. It's all the video modules, all the educational stuff. It's inside of there. Plus, for an extra, again, this one's $997, so an extra $600, you have my guidance walking you through the entire self-paced program. So it's no longer self-paced for the next 8 weeks. So does that make sense? It is still available. You can purchase it. I'll be happy to email you the information if you want to do just the self-paced piece of it and just implement it on your own. And if not, if you'd rather have a bit of still access to it, but then me to walk through it alongside you, that's where the coaching program comes in. But you still get all the same information, plus more, much more. So there's the QR code again, if anybody does want to join. And again, if you join, let's say it's okay if you don't do it right on the moment of this call. We'll give you the next maybe 2 hours after the call ends. You get a bonus one-on-one 30-minute coaching call with me where we just get to talk about your specific situation. You get my undivided attention for 30 minutes. We provide movement suggestions through the group coaching that are individualized. Yep, absolutely. So this again is kind of what sets it apart from what the Hip Lab was. There will be sort of like a core program that we all walk through together, but then each individual person is going to get a semi-customized plan for you because we know that every body is different. And so what might work for one person doesn't quite feel right for you. So basically what will happen is each week we will start with a base program. So, here are the things I want you to work on. And as you're going through that, if it's not working for your body, things are not feeling right, they're hurting, you can either send a message right through the app in our group forum. You can ask questions there anytime, or you jump on the weekly calls and then I will coach you through, hey, I want you to do this instead, try this, tweak this, whatever it is. And we will adjust it for you. And then that will get put into the app. All the exercises are built, all the content, whether it's the videos, exercises, whatever, it's built right inside of an app. So any custom exercises that we've done during our session, they will be loaded into your app so that you can see them. So you don't even have to remember it if you don't want to. Just got to pop the app open and it'll tell you what to do. So hopefully that makes sense. But yes, there will be some individualization in this, which was something that you never got in the Hip Lab. How long are the sessions? Honestly, I've allotted an hour, but really as long as we need them to be. However many questions you guys have, I will stay on the call until all the questions are answered. So they're at 12:30 Eastern Standard Time on Thursdays, starting April 16th, which runs through, I think, 8 weeks. We land around like June 4th, I think is the Thursday. And there's a weekly call every week. 12:30 we'll get on and I will just answer the questions. So there's a form that you'll submit the questions ahead of time. I will answer all of the submitted questions first. And then anybody else who has questions will open up the floor and I will stay on the call until all the questions are answered. If you have questions in between the calls or you can't make the live call, again, you can ask them in the group. My response time on those might be a little slower just because I'm seeing patients during those days, but I will still answer them there. And if it's something that needs more explanation or demonstration, again, we'll make sure that we do it on the call. But you have access to ask questions really at any time through the app. So yeah, but everything's housed right inside of the app, so it keeps it really easy and straightforward. Any other questions? Anybody else have any questions? Hopefully that answers all of them. Really, guys, the biggest thing that I want you to get out of today, whether you move forward with a program with me or it's just something that you want to do on your own, it's okay. You take the path that is going to be the right path for you. What I want you to know, though, is having that trained eye, a specialized eye behind it, really makes all the difference in the world. Where can you get from now the next 8 weeks without having somebody walking alongside of it? What in 8 weeks time, what do you want your life to look like in regards to your hip? Where do you want to be in 8 weeks? Do you think that you could get there on your own and continuing to do what you've been doing? And if you have a plan, then keep at it, keep doing it. Just use this framework and insert it in there. If in 8 weeks time, it's the beginning of summer, people want to be active, you want to be out, you want to be doing things. If you've got goals and you don't want your life to look like it does right now, in 8 weeks from now, this program is for you. We are going to get you there faster than you are ever going to be able to get on your own. It's the same with anything. You can go at it alone, or you can do it with a group of people and the guidance to get you there. People who have done it before. That's what's going to get you there faster. Will you be 100% where you want to be at the end of 8 weeks? Again, I can't guarantee that, but I can guarantee you're going to be a whole lot further. You're not going to be in the same place you're at now. Okay. whatever you've been doing, if it hasn't been working, you're probably going to be stuck there in the next 8 weeks. And I don't want that for you. I truly want to see you thrive. And this is how we're going to do it. So I'm excited for anybody that jumps into this. I'm so excited to be able to walk alongside this with you because I already know what's on the other side waiting for you. It's a scary jump. It's hard to risk it, especially when you know that nothing has worked. But I know what's on the other side waiting for you, and I cannot wait to take you there. If you guys have any questions, please feel free. I'll wrap it up, but if you have any questions, feel free to, you can send me an email. You can message me. Usually I respond faster to emails than I will on social media, but feel free at any point. If you are still in the challenge, keep tracking. It does not end when the challenge ends. It gives you a good starting point, but now you are responsible for taking all that information and turning it into something that works moving forward. So you know your flare pattern, you know what's calmed it down. Now go follow that core framework. Rebuild the movement patterns, rebuild the strength, bring it into everyday life and the goals that you have. And that's what's going to get you there. And if you don't know how to do those things, come find me. That's where scan that QR code and we'll take care of you. So I loved talking to you guys today. Kristen, thank you for being here. Thank you guys all for being here. Alexis, Isabel, Jessica, Lynn, you guys are awesome. I'm grateful that you carved out an hour of your Sunday to spend with me. So I hope to see you guys really soon and have a good rest of your day.